Assalamu alaikum everyone. Welcome to The Health Show. I am live from British Muslim TV studios right here in Wakefield. My name is Sulthana Ahmed. I am a GP and your host for today. I sincerely hope that your Ramadan is going well and that you are able to reap all the blessings from this wonderful month. Not long to go now. We are almost there to Iftari time. So last week we did do a Ramadan related topic. This week we are talking about something completely different but just as important. Now, considering this has been going on since humans have existed, I think you'd be quite surprised to know that not many people really know what to expect, what it exactly is, and whether or not they should receive treatment for it. I am talking about the menopause. Now, it's also known as the change that women go through as they age. And whilst this does apply to just women, I am hoping that men will also watch this episode so that they're able to support the women in their life with the information that we are going to talk about today. So, to discuss the topic with me further, I have the wonderful Dr. Andleep Ahmed, who is a fellow GP. Assalamu alaikum, Dr. Ahmed. Thank you so much for joining me today. How are you doing? And please do tell us about yourself.
Assalamu alaikum, Sultana. Thank you for asking me to come on. My name is Dr. Andleep Ahmed. I am a GP in Northwest London. So I've been working in the NHS for about 27 years now.
Wow.
Alhamdulillah. And so that's I'm also a chair of governors in the local area. I do a lot of work for the ethnic minority community, I am also going through the menopause myself. So I realised it wasn't discussed very openly, especially in our community. So I decided to start talking about it on Instagram, which I just joined during lockdown. That's how I met you.
Yeah.
Mashallah. So so I kind of like wanted to give it a more personal approach, but also give the facts out because there's a lot of misinformation as always around the topic.
Yeah, absolutely. And I'm glad that you mentioned it because it's not really a taboo topic, but it's definitely a muted one. You know, it's very hush-hush. People don't really discuss it openly at the dinner table, and I'm not sure why. So we will answer your questions about the menopause. So do feel free to message on WhatsApp or call the local landline. So I'm just going to go straight into it. Please, so what is the menopause exactly? What happens in a woman's body to bring on the menopause?
So the menopause is a completely, natural process. Just as starting periods is the tail end of that. It's when you stop having periods and you're no longer able to fall pregnant naturally. Now, it tends to occur, the average age is between around, I would say, 47 to 52, but some women can start a little bit earlier and it can be a little bit later. If you start going through this, the menopause before 45, then, that would be something that normally a GP would want to investigate a bit further. And what you may notice is that the first thing that you'll notice is that your periods will start changing. Now, a lot of women experience all the symptoms for quite a while before their periods actually stop. And some women can experience it for a good 3 or 4 years before they notice problems with their periods. So a lot of women, actually don't know that they're actually starting to go through the menopause because their periods are okay, but the periods is actually just one aspect of it. And then the symptoms can continue for up to 4 to 5 years after your periods stop, but some women actually can continue for up to 10 years. So that's it in a bit of a nutshell. And the reason it happens is because your levels of hormones are starting to drop, mainly estrogen and then progesterone.
Yeah, so brilliant. So yeah, as women stop releasing the eggs and the estrogen levels fall down, they'll see various signs and symptoms. So they might feel some symptoms in themselves and also notice changes in their body. Now, not everybody will have symptoms. Some women actually have absolutely nothing. They sail through it and they're absolutely fine, which is great. But actually, quite a lot of women do go through those symptoms, and they are quite varied. And I do want to spend quite a while talking about the various symptoms, if that's okay with you.
Yeah.
So can you go through what a woman should expect when she starts to go through the menopause?
Yeah, absolutely. So, you're quite right. Some women experience no symptoms, and, I don't like this one. Yeah, that's joking. About a good 8 in 10 will experience symptoms. So like I said, the first thing that you may actually start to notice, and this is what we call the perimenopause period. So that is when you start noticing your periods either become less frequent or even more frequent, they become lighter or heavier. But even before that, you may start noticing things like your skin starts to change, you start getting mood swings, you start getting hot flushes, night sweats, you have problems with concentration and memory, irritability, mood swings. You may also notice things like your breasts become tender, vaginal dryness, your libido or your desire to have sex may also drop. The symptoms for menopause are quite extensive. When people think of the menopause, they just think your period stopped, but there's actually so many other symptoms, which can be actually really distressing for a woman. And I can actually really relate to that because I'm going through it myself, the perimenopause. Other things that might happen is that you may notice hair appearing in very odd places. And also things like, another effect of the menopause is you may lose muscle mass as well. So you can start noticing things starting to slightly sag. And obviously, the lack of hormones has an effect on the bones and that, increases your risk of osteoporosis.
Yeah, so the symptoms are quite varied, affecting loads of different systems in your body. And you won't necessarily have all of them. They won't necessarily come in a logical fashion or a logical order. And you might notice the non-period symptoms before you actually start to miss your periods. And so women might find it really difficult to pinpoint, oh, this is the menopause that I am going through.
And I think, women at that age, just kind of like put it off. A lot of women who've spoken to me just said, oh, I thought it was just part of becoming old. Or it's, I'm a busy, working mum, et cetera, et cetera. So I started noticing, my skin becoming really dry and itchy. I noticed I was getting very forgetful. My children thought that it was hilarious because I would walk into a room and forget why I was there.
Yeah.
Or like my glasses, where's my glasses? And it was on my head. But things like that. And then I actually noticed I was getting more frequent urine infections as well. And only after a while did I started noticing the change in my period. So, if you are noticing things that aren't, and tiredness, that's quite overwhelming. The tiredness is quite overwhelming. And a lot of women just put it down to, they ignore it. But it's very important that they realise and they speak to their GP about it.
Yeah. And I remember when I was a med student, I was on an obs and gynae ward, and there was a midwife who was quite vocal about the fact that she was going through the menopause, and she used to have drenching sweats whilst on the ward, and she found it quite embarrassing. And a lot of the time it is embarrassment, shame, or some sort of social issue that brings women to the GP saying, I can't continue like this, these are the symptoms that I am struggling with. And a lot of the times women actually are afraid that there's something else underlying going on, and they won't necessarily know it's the menopause. So yes, absolutely, you don't have to suffer in silence or put up with it. We manage this as GPs quite regularly, and we do welcome consultations on it. So just before we move on with the symptoms, I think low mood and depression is also quite a significant part of the picture as well in terms of the hormonal changes. And the only reason why I'm singling that out and mentioning that specifically is because in the South Asian community or the Muslim community within the UK, it's quite difficult for women to come forward and discuss their low mood or depression as well. Do you have anything to say about that aspect of the symptoms?
Yeah, I think just going back to what you said about being on the ward and, witnessing that midwife, I think in general, what I even realized is that when women were having, going through their menopausal symptoms, they were often laughed off or fobbed off as, having a moment, or, she's going through the change. And people would think it was quite funny, when it's actually very distressing for the woman. And yeah, you're absolutely right with the low mood. And in particular in our community, it's not really spoken about, but, it can be really very, very distressing. I've met some women who are, in fact, I had one patient who was almost suicidal, which was very, very unpleasant to see as a GP, and why it's talked about, I think, especially what menopause isn't talked about in our community as it is. Now, then add to that the fact that you get low mood with it. I think there's a huge taboo to do with mental illness amongst the British Muslim community. But we are getting better at it. I have to say that we are becoming more aware.
Yeah.
And I think, especially now I see, lots of mosques coming forward with positive talks about, mental health. I think, again, it's just that sense of not feeling comfortable about discussing our emotions.
Yes.
And we're not very good at talking about our emotions. I think, we witnessed our own mums and grandmas, and I would wonder what was wrong with my mum.
Yeah.
She was like, she'd literally drip with sweat.
Yeah.
And have go off on massive rages. And, as a community, we're used to our mothers, being, with a chuckle, running after you, not being naughty. But actually, I realised now she was going through the menopause.
Yeah.
So I
think, and it's quite important that you mentioned how sometimes these symptoms are trivialised and minimised or kind of given, laughed off amongst family or friends. So that has been a really useful discussion. We will come back after this short break to talk about the treatment options. Please do come back and join us soon. Assalamu alaikum everyone, welcome back to The Health Show. I am Dr. Sulthana Ahmed, and with me I have Dr. Andleep Ahmed, and we are talking about the menopause. So during the first half of the show we talked extensively about the different types of symptoms that women can have whilst going through the change, and how often people don't recognise that it is the menopause because it's so varied. The symptoms may be trivialised or laughed off, or just kind of said, oh, she's a bit hormonal or emotional. But actually, the symptoms can have a massive impact on the quality of life for the person who is going through it. And so it's important that we do take these symptoms seriously and discuss with your GP. Now, Dr. Ahmed, when, let's say, a woman has identified there's the symptoms ongoing that she's not happy with and she would like some help, she has suspicions that this may be the menopause or perimenopause, what can she expect at the consultation with the GP?
As women, before they go to the GP, is take a list of all the questions that they want to ask the GP, because it actually makes our life a lot easier if you come prepared with questions. And also what I would advise women to do is have a read of the NICE guidelines for menopause, which is the National Institute of Clinical Excellence. It's very reader friendly, and it will also explain to you, what you can expect and the different treatment options, and you can make an informed choice. So what will happen is when you go to the GP, we'll sit you down, and we tend to diagnose the menopause, perimenopause, by actually talking to you and taking a history about your periods and all other symptoms that are associated with this time. We don't actually need to do a blood test to confirm the menopause, but what we might do a blood test for is to make sure it's nothing else. So, for instance, like if you have an underactive thyroid, it can sometimes, cause very similar symptoms to it. And what we want to maybe just check things like things like if you're prone to diabetes, things like that. We check that, make sure you're not anemic. But there is a hormone we would measure called FSH, which you can measure, but it's much less, we're doing it much less now, because actually some people have come back with normal levels and they're going through they have menopausal symptoms. So we tend to do blood tests to make sure there's nothing else going on. And then what we would do is, talk about things like, making sure they're aware about their breast health, teaching patients about breast health examination, and making sure, that they understand that. And we would start, one of the things that I would start by doing is talking about lifestyle changes before we would go even on to medication. So things like making sure you're eating well, getting enough calcium, vitamin D, and omega-3, omega-6 types of food. I would try and do some regular exercise, which will improve your bone and muscle strength, especially resistance training is meant to be very good. If you are smoking, stop smoking. If you are drinking, stop drinking, or cut it down. And those are the things that we would advise, lifestyle changes first. And then what you can do, it depends on each individual patient. And we would discuss hormone replacement therapy. And it depends on your individual case, whether or not you have a uterus or not, and whether you're still having periods or not. And that's the simplest way I can do it.
Yes, thank you for that. So HRT it can be quite complicated, and essentially we are trying to replace some of the hormones which are naturally decreasing in your body. And as Dr. Andleep Ahmed has said, the type of hormones you get will vary depending on whether you're still having periods, whether you have a womb or not, or ovaries or not, things like that. So that specific discussion is definitely best left with your GP, because we are not giving medical advice on the show, just education. But just as an overview, is HRT just a tablet, or is it available in different forms? Because some people don't like taking tablets.
No, absolutely. So depending on your individual circumstance, HRT comes as tablets, it comes as patches, there's also gels as well. So it depends on what would suit you, and what, for instance, what your individual sort of like risk profile is. And it's quite a tailored treatment.
Yeah.
GPs are used to doing it, but like you said, we can't, not one size fits all. So it's best you go and speak to the GP about it. And there's a lot of misinformation about HRT. There's whether it's halal or haram, it's fine. It's completely halal to take it. But if you do have any worries, you need to speak to your GP and best to get your information from them. There are other things, that you can consider, but HRT also does. Obviously there are side effects from HRT, which we do need to mention. There is a slightly increased risk of blood clots and breast cancer. However, the doctor will discuss it with you, your individual case, and it's what we call risk versus benefit.
Yeah. And
the benefit of you taking HRT, the majority of the time, outweighs the risk. And we would ensure that you're regularly followed up, and so that you don't end up taking HRT for years on end unchecked, which is what used to happen many, many years ago. But that doesn't happen anymore.
Yeah, so I do remember probably about 5 or 6 years ago now, in the media there was quite a lot of scare around HRT and cancers, HRT and blood clots, and I do recall there being a massive shift towards doctors not prescribing it. And since then, there has been a lot of research out which actually says, yes, there, in certain specific cases, if you're taking the HRT for a specific amount of time, there may be a very small risk, an increase in risk of, certain cancers or blood clots. But actually, the overall risk is still very low in a lot of the cases. And in women who are having quite major symptoms, sometimes it might be that the risks the benefits outweigh the risks, and you would still go ahead with the treatment options. But like you said, it's a tailored discussion with your GP. They can give you specific facts and figures about, you know, what the actual risk in your scenario is. We have very helpful tables, which I usually discuss with my patients as well. And it's absolutely fine for you to go have a chat with your GP and decide that you don't want it. That's absolutely fine. That's not time wasted. And like you said, we would usually check initially at 3 months and then annual reviews to make sure that the treatment is still indicated. So that was really helpful. Now, I mean, I know that in my experience, not many South Asian women or Muslim women come forward for HRT. What has been your experience, or shall we talk a little bit about that as well?
Yeah, it's actually really interesting. Since I actually started talking about it on Instagram myself, I think people were quite surprised that, I was talking about it quite openly. And that's the reason, is that I wanted to break down the taboo around it, and say, actually, you know, I'm actually struggling, and I need a bit of help. But actually, one of the things that actually does help is talking about it. There are a lot of support networks from other women who are going through it. So, you know, in our community, I think the reason we don't talk about it, I think some of it is lack of, understanding of what it is, the lack of education regarding the topic as well. Changing a sort of school of thought that, you don't just have to put up with it. There are things that we can do to help you. And I think also culturally, I've spoken to some women about it, and in some, communities, being fertile is still considered, quite an important thing.
Right.
And I believe, in certain communities, even up to the age of 50 plus, women are expected to conceive and have children.
Wow.
In certain communities. So once they go through it, they feel no longer valued in the community. So that was quite an eye-opener for me. I never actually thought about that. So I think and I think a lot of women feel that they feel like they're not of any use anymore, which is actually very sad, because they feel that they've gone past their sole purpose, which is to be able to have children. And women, as we're always talking about, are far more than that. And I would encourage women to speak to their partners as well, and explain to them and their family that this is what's happening, this is what I'm going through. And I actually gave them links to the NHS website so they can read about it. And they're actually much more sympathetic now. But a lot of women are still struggling. It breaks my heart.
Yeah, absolutely. Because I think growing up periods are kind of an invisible force that exists within, Muslim or South Asian households. They're just not talked about, and unfortunately, that seems to extend into the menopause as well.
But also, Sulthana, do you not also think that I had one of my nieces come forward, and she said, "I'm so happy you're talking about this. This is not talked about at all in school or in biology. They talk about periods, but not this. And even in medical school, I don't remember being taught a huge amount about it."
Yeah.
And I think that is really important. Education is very important.
Yeah, I think definitely certain women's health issues are pushed to the side, unfortunately, even in mainstream medicine. But like you said, things are changing. So hopefully the future will be better for us and people younger than us. So if somebody wants to find out more about the menopause or HRT, do you have any websites that you specifically recommend for them?
I would, the NHS website is always the best. It's got the most, correct, clear, and UK applicable information. The problem with going to the internet is you read about something that doesn't apply to this country. There's also Dr. Louise Newson. She has Menopause Matters. And we know our sister, Dr. Nighat Arif, she is a huge advocate of the menopause. And, she talks about it all the time on her Instagram page. She's also on TikTok, bless her.
She is, yeah.
She's very proactive. about talking about it. And she's actually the one who encouraged me to talk about it as well. But I would recommend the NHS website always, and it's very good. And the National Institute of Clinical Excellence has a fantastic set of guidelines, which I would definitely recommend.
Brilliant. Thank you so much for your time, Dr. Andleep. This is all we have time for today. You have a nice evening, and I hope you enjoy your iftar. Thank you so much for watching today's episode. I really hope it has been beneficial for you. Inshallah, I will see you soon on The Health Show. I'm Dr. Ahmed. Take care.